Namaste.
Hi.
I'm Dr. Rupal Shah. I'm sure you must be wondering that people talk about getting rid of their glasses. Doctors tell you that they can do it safely. But you sometimes find that your doctor wears glasses. And that makes you wonder why they don't get it done. And this question I have come across by many patients because they keep feeling कि आप तो बता रहे हो पर डॉक्टर्स तो खुद तो करवाते नहीं हैं. And to break that myth, I have a very special person here with me, Dr. Syed Maaz from Hyderabad. Dr. Syed Maaz is a prolific corneorefractive surgeon. He's been practicing for more than 15 years now, and he's undergone a corneal refractive surgery, specifically the SMILE surgery, 11 long years back. Since then, his practice has actually touched the skies. So I would like you to be listening from the horse's mouth what his experience was in undergoing corneal refractive surgery and what made him decide and how he went through the whole thing. So Dr. Maaz,
Hi.
welcome. I would like you to answer the first question, that why did you decide to do a corneal refractive surgery in the first place?
So when I took this decision, I had come to your center and seen Relax Smile for the first time. But I had been doing refractive surgeries for 4 years then. And when I was wearing glasses and telling my patients that this is a very safe and a short procedure, the most common question I used to get back from them was, if it is so safe and a short procedure, why are you still wearing glasses?
Exactly. It's a valid question.
And that always used to ring in my mind. But then I was not having, I should say, the strength to take that decision. But when I saw the Relax Smile procedure and I saw the safety and the outcomes of those procedures, I thought that I should get this done. And in a way, it is like saying, practice what you preach.
Exactly.
So when we are preaching people that it is a safe procedure, and for everyone, including ours, the eyes are the most precious part.
For anyone.
For anyone. And when we are telling them that it's safe, we should be sure that it's really safe, because we are not doing it on anyone else but on our patients who come with us with such amount of trust. So I thought that I should take this decision and get it done on my own eyes.
And what had been your experience like?
Well, the experience was fantastic. To tell you the truth, I was expecting that there would be, some pain, blurring for a longer period of time. But it was more than what I had expected. The surgery part is so smooth, it looks as if you're just lying down under a sky and a cloud's appearing and the cloud disappears. And as a surgeon who had done these procedures, I knew that it would take 20 seconds and 25 seconds for that to happen. But actually, since you are there when the thing is getting done, the 25 seconds too look very short, because at that time you are thinking of other things too that run in your mind. And then the lenticule extraction in your hands, I think, took a minute or two. And with the numbing drops in place, you don't actually feel anything. But yes, for the first 3 hours, there was a bit of watering and discomfort after the procedure, which, from the second day, since you start enjoying the normal vision, you forget what had actually happened and you are back in life.
And of course, in life, there is no gain without pain.
Exactly.
But here, I think the gain is much more than the pain.
Correct. And let me tell you an experience. What I had done post my surgery was that I had planned for the next 5 days, I would not operate on patients and wait for the edema to subside and for the clarity of vision to come back. When I came back, the we normally, as ophthalmologists, we can always postpone our procedures for 3 or 4 days. But what had happened was that there was a patient who had come with a tear in his eye, a corneal tear, because
Which
at
is
that,
an emergency.
which is an emergency, because I remember the day I got it done was a Sankranti day, and this person had got a tear because of the thread rubbing over his cornea. And I was called and I was told to do the procedure. I had a little hesitation. I called my colleague along. I took one look at the microscope and I said, wow, I was seeing actually better than what I was before. And I said, I can operate, and I had absolutely no problem. And I had done the surgery on 14th on my eyes, and I was operating on other people's eyes on the 16th of
That's really wonderful.
That was just in less than 48 hours. I was operating without any issue as such.
That I think will help people's mind to be put at ease.
Correct.
Because most people wonder when they will be able to go back to the normal
Correct.
routine.
Correct.
And they don't really have a lot of days to spare.
Correct.
They're all young people, they are
Correct.
in their primes.
Correct.
They also need to travel, work on computers.
Correct.
And also pursue a lot of sports and activities.
Absolutely.
Do you also have such activities that
Yeah,
you pursue?
I play badminton, and I can tell you the problem I used to have with the fogging of the sweat when you are in between a rally,
Yes.
and that has totally now disappeared because of this. And now everyone travels, so even I had traveled and done a bit of scuba diving and swimming, and that was a totally different experience without the glasses. And that, those little things in life, when you get those advantages, and you realize that only after you get it done.
Exactly.
My sole reason to get it done was to walk the talk, to tell patients that I have got it done, and I believe in the technology and the procedure and the safety of the procedure.
I think that's a very important thing.
Very important thing. But then, once I got it done, I never knew that these little advantages I would be able to experience, and you experience them only after you get it done.
So it's ummeed se zyada.
Correct. Totally agree with that.
Also, do you think that your patients really benefit, especially the ones who are in contact sports, or people who could not do it before because they were afraid of a flap? Do you
Correct.
think that this is really making a big difference with the advent of smile coming into picture? The smile as a procedure.
Correct.
Have you been able to put smiles on many more people than
People.
you would have otherwise been able to do?
Absolutely. The safety profile of this procedure is unmatched. The other advantage this procedure has is the lesser incidence of dryness of eyes. Now with people on the computer screens, and even if they are not computer professionals, use of gadgets has become so very
Absolutely.
common. Now these gadget use resulting in dry eyes is a common problem, we would agree, even with people who have not got a refractive surgery done. So this procedure with the less quantity of dryness of eyes would definitely be an advantage for people who are spending long times on their gadgets and computers. And it's totally unavoidable nowadays. You can't just tell people that you should not be using gadgets because they are now a part of our lives.
So for how long did you use your dryness drops?
I you had told me to use them for 2 months, and I stopped them after 2 to 3 weeks. They say doctors are not good patients, and I was also one of those. But the reason
you
I
didn't
stopped
need it, I
was I didn't actually need it. So in 3 weeks, I was absolutely back to normal without using any drops. So when I had taken the decision, it was a personal one, not influenced. How did you feel when I told you that I want to get a refractive surgery, a Relax Smile done by you?
So I was pleasantly surprised. I was also happy that you were going in for a procedure which was going to really be useful to you.
Correct.
Let me tell you, it was not something that was totally new. I had a couple of Malaysian doctors. One of them was an avid scuba diver, and he was in the army in Malaysia. visiting me to look at the smile procedure when I was studying it. I think almost 6 months before you got your procedure done. And he also decided on the spur, after looking at the procedure, that he wanted to do it on himself. And 2 of them got it done and went back to Malaysia and operated on the next day. So I was pretty confident that it is going to be working well for you. And I think doctors, especially eye surgeons who have been doing refractive surgery, also have an eye to know which procedure should be done for them, because they know the nitty-gritty, they know how things would work. And I think that's why it's easier when you look at a procedure which is so safe and effective to take that decision to go in for yourself. So I think you also showed that the perspective and the thing that made you decide.
Yes, and it's been a life-changing experience since then.
So for all those people who are wondering whether Smile is going to work for you, here is a doctor's perspective, and it can do wonders in your life. So welcome to the happy world of Smile.
Follow Planet LASIK and post your queries to get answers from the experts.